Hey everyone, welcome back to my channel. It's Dr. Alessandro. And in today's video, we're going to be talking about the silver filling, or what's also known as dental amalgam. Now, this is a bit of a controversial topic, so bear with me because there is some important information for you. So, what is dental amalgam and how long has it been used? Well, silver fillings, or dental amalgam, has been routinely used in a relatively modern composition, if you want to call it that, for actually the past 3 centuries, really. And it has been used very successfully. Now, a lot of questions have arisen because of purported safety concerns. Now, dental amalgam is a mixture of a whole bunch of metals. And that's what amalgam means, a mixture. And one of the metals used is mercury. Now, we all know that mercury in its elemental form is dangerous. It is toxic. There's no question about that. But when mixed with all of these other metals, the mercury component actually holds all the metals together. And it really, yes, it does get emitted, or it leaches out slowly, very, very slowly, over the course of time, but never really in quantities that cause any harm. You can probably get more from your tuna, your cod, or if you live next to industries or near industries that utilize mercury for making certain items, like fluorescent bulbs, for instance. They contain mercury. So that said, in 2019, the FDA came out and issued a report. So the Food and Drug Administration issued a report saying that for the general population, dental amalgam is perfectly safe, and it does not recommend the removal and replacement of that material if it is working well within a tooth. In 2012, the magazine Toxicology issued a study, a very long-term and thorough study, which again, basically gave the green light for amalgam, saying that it had no real safety or health concerns. So with historical reports from a number of different agencies and review papers indicating that dental amalgam is safe, I tend to believe that information. I tend to believe that science. And until a large volume of scientific reports indicates otherwise, I will support those statements, and I will go ahead and say that dental amalgam is safe and should be used. Now, clinically, silver fillings, or dental amalgam, is a very effective material. It is low cost, and it can be used in clinical situations that the modern or newer material called composite resin, which is white or tooth-colored filling material, cannot be used. For example, if a field is wet, that is, if there's a lot of saliva in a field, dental amalgam can be placed and it can be used actually successfully. Whereas the tooth-colored or white filling material really can't bond well to tooth structure if the field is too wet. So think about the mouth. It's a pretty wet environment. Unless the conditions are really good, your tooth-colored filling material can, generally speaking, not really be used all that well. But silver filling, or dental amalgam, can. Now, in my own clinical experience, I've seen silver fillings last 30, 40, 50, even 60 years and remain and function well for a patient. Whereas tooth-colored filling material, or white, I have seen last as long as 35 years. So that's a good lifespan. But the 35-year-old tooth-colored filling material that I did see was placed under rubber dam isolation, which is the best type of isolation to keep things dry. And the patient in question also had what amounts to outstanding home care, among the best of the patients I've ever met. That is brushing at least twice daily and flossing every single day. So with that kind of home care, you know that whatever you place in the mouth has an excellent chance of lasting a very long time, no matter what it is. So in the absolute best of best conditions, sure, a tooth-colored filling material can last a long, long time. But the average person isn't quite that good with their home care, and the average provider doesn't use rubber dam to keep things dry. So those are pretty important caveats to keep in mind. So that said, on average, when I look at patients that have had silver fillings versus tooth-colored fillings. The silver fillings last a lot longer in my experience, and you should know that. That is something that's very important for any of my patients or any patient around the world to know that silver fillings are stronger yet than the tooth-colored counterparts, though because of the improvement of materials, your white filling materials are getting better and better. So they are getting better, and eventually I think that they will become totally equal, and science will figure out a way for the tooth-colored filling materials to work in wetter environments. So when that day comes, then I'll say that the two materials are equal and can be used interchangeably, even in very difficult clinical conditions. Until then, and as long as the current research and scientific publications conclude this, I believe that silver fillings or dental amalgam is safe to use and should be used for a number of patients, and can be used very successfully. So that said, I appreciate you joining me on this video. Thank you so much. And please leave your comments, whether you do agree or disagree. And I look forward to hearing from them. And again, hope you're all staying well and healthy.